Welcome to another series because we're talking about the triangular spaces today. We have avoid the quadrangular space. The next video is here because you'll be understanding them very well. Because what is forming the quadrangular space is equally forming the triangular space, so they have the same boundaries. So if you have checked my illustration of how I explain the quadrangular space, so these triangular spaces will be very important, and it's very easy because when you do your hand the same way I asked you to do your hand there, to be much more easier to understand the word triangular space. If you are just joining me for the first time, make sure to subscribe and turn on your post notification button so that anytime I drop any video, you'll be sure to be notified. If you want me to make a video for you, drop it down in the comment section. When I go to it, I'll make that video for you. So let's just jump right into the video. So welcome guys to another spaces of the upper limb. We have treated one of the subscapular spaces already, which is the quadrangular space. When you put your index and middle finger on top of your second index and middle finger, you get a quadrangular space in the middle, and by the side you get a triangular space above and below. So we want to talk about the triangular spaces. Very simple. The triangular space, just like that one. The other one is a quadrangular shaped space which transmit neurovascular structures from the axilla to the posterior compartment of the arm. Now this triangular space also do the same thing, but in triangular space they can either transfer neurovascular structures from the axilla to either the anterior or posterior compartment. So they can transfer it to either of them. So it depends on the triangle you are focusing on now, because we have the upper triangle and we have the lower triangle. So the upper triangle shape space and the lower triangle shape space. But sometimes the lower triangle can also be called the triangular interval. So for your exam now, you might not see the lower triangular space. You can see the triangle interval. So the upper triangle space and the lower triangle space. So we'll be talking about them one by one. Just know that after the quadrangular space in the middle, by the side is you have an upper triangle, below you have the lower triangle. So all these are subscapular spaces, just spaces around the word scapula that also transmit neurovascular structure. So they are not major spaces like you have the cubital fossa and other ones. Do you get it now? So we'll be picking the upper triangular space here. So we'll ask ourselves, what is the boundaries of the upper triangular space? So still put your hand like that. So if you put your hand, what are you going to see? So put your right index and middle finger on your left index and middle finger. So when you put it, you see a quadrangular space in the middle. Check the other side of, not the downward, the left side, the lateral part of the triangular space. You will see a triangle, small triangle, just close to the webby part of the middle part of those index and middle finger. You see that triangle that is there. Remember that hand you are crossing. Okay, the first hand you are crossing on the other hand. Above is the teres minor, below is the teres major. Now what can you see lateral? Now if you see lateral, you see the long head of tricep. So if you remember the upper triangular, now you remember that above is the teres minor, below is the teres major, while lateral is the long head of the triceps. So what is passing through this upper triangular space? You can see the circumflex scapular artery. The circumflex scapular artery transverse to the upper triangular space. Both the vessels, both the arteries and the vein of the circumflex scapular arteries and vein. The circumflex scapular artery is a branch of the subscapular artery. The subscapular artery is a branch of the third part of the axillary artery, both the arteries and the vein. So now the next one we'll be talking about is the lower triangular space. So the lower triangular space, you can also call it the triangular interval. Don't forget. So the triangular space or the upper triangular, so you can call it triangular space or the upper triangular space. Finish. While the lower one can be called the lower triangular space, or you can call it the triangular interval. Don't forget. Now the lower triangular space, what is the boundaries of the lower triangular space? So if you put your hand together, you check the triangle that is below the teres major, the triangular that is below, the triangle below the teres major. So the triangle that is beside the long head of tricep, that one is the upper triangular, while the one that is below the teres major is the lower triangle. Now what is in the lower triangular space or the triangular interval? What is above? You have the teres major. What is located medial? Medial is the long head of tricep, while lateral is was shaft of the humerus, not surgical neck of the humerus. The surgical neck of the humerus is for the quadrangular space, while the shaft of the humerus is for the triangular interval or the lower triangular space. Now this one, it transfers neurovascular structures from the axilla to the what? Posterior compartment of the arm. This one is very straight. Posterior compartment of the arm. It can also transfer it to also the anterior compartment of the arm, but usually the posterior compartment of the arm. Why? Because its content is the radii nerve and the what? Profunda brachial arteries and vein. The radii nerve and profunda brachial arteries and vein. So the profunda brachial arteries and vein supplies the anterior compartment of the arm, while the radii nerve supplies the posterior compartment of the arm. Don't forget. So I have treated the upper triangular space and the lower triangular space. Don't forget. Now, what is the clinical correlation or the clinical scenario to this part here? Because in the first one, you do not have any nerve, so there couldn't be any damage to the artery. So they can also be done during scapular fracture. You can also damage the circumflex scapular artery in scapular fracture for the upper triangular space, which is not usually common. Well, for patients that have a direct trauma or direct blow to the back, it can fracture the scapula and damage the circumflex scapular artery, which can be one clinical correlation. But the second clinical correlation is that you can also damage the radii nerve or compress it, causing what? Triangular interval syndrome or lower triangular space syndrome. So in this one, when you compress the radii nerve at that place, what happens? There will be what? Neuropathic pain. There will be pain in the back of the hand because the radii nerve supplies the skin and the muscles of the posterior compartment of the arm, forearm, and hand. That's why they call it the largest branch of the brachial plexus. There'll also be paresthesia because you'll be having loss of sensory distribution about the radii nerve. Like I said, it supplies the muscles and it supplies the skin of the posterior compartment. Also, there'll be weakness of the tricep, the anconeus, the muscles of the posterior compartment of the forearm and the hand. So there'll be difficulty in extension of the shoulder joint, extension of the elbow joint, and extension of the wrist joint. So I hope it all made sense to you and you have understood all we have talked about on the word triangular spaces. Because we said it's a triangular shaped space which transfers neurovascular structures from the axilla to either the anterior compartment or the what? Posterior compartment. So it's triangular, while the other one is quadrangular. So both of them forms the what? Subscapular spaces, or you can call it the intramuscular space around the what? Scapular region. So very simple. So watch it over and over again and follow what I wrote down in the book, because it will be very, very easier for you to what? Follow. So if you are new to my channel, subscribe and turn on your post notification button so that anytime I drop any video, you'll be sure to be what? Notified. So I will see you in my next video. Bye bye.